All right, we are going to call the special long-term healthcare committee into order. Today is March the 11th. It is 3:17. Madam Clerk, can you please call the roll?
Alderwoman Boyd, Alderwoman Sanye, Christine Ingracia,
Present.
Danielle Spradley, Jamie Opsel,
Present.
Marjorie Moore,
Present.
Harold Braswell, Chris Bakley, Cassandra Kaufman,
Present.
Lavetta Richardson, Cindy Jackson, Kevin Anthony, Andrew Lackley, Laura Barrett, Kathleen Holmes, Annalise Stover,
Present.
Alderman Aldridge.
Present.
12 present, you have quorum.
All right, thank you, Madam Clerk. Second or third order of business is approving the minutes from Monday, September the 11th, 2023. Is there a motion to approve the minutes? So moved. Second. Madam Clerk, can you call the roll?
Alderwoman Boyd, Alderwoman Sanye, Alderwoman Ingracia. I'm sorry, Christine Ingracia,
Aye.
Danielle Spradley, Jamie Opsel,
Aye.
Marjorie Moore,
Aye.
Harold Braswell, Chris Bakley, Cassandra Kaufman,
Aye.
Lavetta Richardson,
Aye.
Cindy Jackson, Kevin Anthony, Andrew Lackley, Laura Barrett,
Aye.
Kathleen Holmes, Annalise Stover,
Aye.
Alderman Aldridge.
Aye.
12 aye votes.
All right, by the vote, we've sustained the motion to approve the minutes from September 11th, 2023. Item number 4 is committee discussion, and today's discussion will be on the report that has been coming together since the committee was set up. Everyone should have either the reports in front of them. For the ones online, it was sent out. And for the people and the viewers watching, we are working to get the report up and live so people could be able to see the report as we follow along. But as we're working on that technology difficulties, we will continue to proceed. And this report also will be published after the committee approve it. It will be also live on the city website. So first, I want to kind of go backwards a little bit. So on May 5th, 2023, the Board of Aldermen of the City of St. Louis passed Resolution 13 and created a special committee to investigate the status of the long-term healthcare facilities, including non-for-profits, for-profit providers, regular and their demographics, rates to pay, staffing, pipelines, systematic problems, and possible solutions. Madam Clerk, I will need you to read the resolution that we passed this session, but this special committee report has been worked on over the last, says 10 months, but I think it's probably about 13 months to come up with solutions and really dive into issues that are going on in our long-term healthcare facilities. Out of the report, we were charged from President Megan Green to come up with recommendations for the city of St. Louis, and we also went a little further and came up with recommendations that we will be passing over to the state as well to the federal government. But before we dive into the report, just so we can kind of remember what our charge was, I have Madam Clerk read this year's resolution that was passed.
Resolution 13, whereas the Special Committee on Long-Term Healthcare Facilities convened on 2022 through 2023 sessions needed additional time to hear testimony and complete its report. And whereas the COVID-19 pandemic has ripped through communities and healthcare facilities, inflicting unimaginable suffering, healthcare providers and frontline workers have struggled to provide the care that St. Louisans desperately need. Whereas nursing home facilities and home health providers have been the forefront of these needs. These healthcare workers have experienced low pay and difficulty working conditions for years. Whereas the majority of the nursing home facilities in St. Louis have collective bargaining agreements with labor unions have better health care outcomes for residents who contracted COVID-19. Ensuring unions' access and right to organize is an essential part of solving the long-term health care crisis. Whereas the implementation of workplace safety and health programs is an essential factor in reducing the extent and severity of illnesses. It is widely known that infections are a leading cause of death and complications for nursing home residents and home care recipients. Whereas staffing shortage have further strained nursing homes during the pandemic. In response to challenging work conditions and the high risk of COVID-19 infection, some nurses, certified nursing assistants, and other workers are leaving the sector during this crucial time when there is an increased demand for their skills and expertise. Whereas healthcare worker pay is often low, the city recommendation of $15 per hour. The committee should look at ways to help employers reach higher rates of pay to provide hazardous pay. Healthcare workers are often working in unsafe conditions because of inadequate staffing. It is essential for healthcare workers to be respected, protected, and paid well to do an important work they have to do. Now, therefore, let it be resolved by the Board of Aldermen of the City of St. Louis that the creation of a special committee be authorized for the purpose of investigating the state of long-term health fields, its nonprofit and for-profit providers. Be it still further resolved that the report will be making recommendations regarding safe staffing, equitable pay, and advocacy for worker safety and worker training. The aforementioned special committee is not limited in size, but may consist of members of the board, older adults, individuals with cognitive or functional limitations, family caregivers, healthcare force workers, members who directly provide long-term health services. The special committee will also seek input from the experts in the fields of worker safety, as well as experts in long-term care. Introduced this 5th day of May, 2023, by the Honorable Rasheen Aldridge, Alderman of the 14th Ward, and the following co-sponsors: President Megan Green, Daniela Velasquez, Ann Schweitzer, Shameen Clark Hubbard, Alicia Sanye, and Shane Cohn.
Thank you, Madam Clerk. So again, over the last 12 months or so, I would say the members on this committee, the ones that are here in person and on the Zoom Live, have really dived into an issue that we've been probably knowing for a long time, that our long-term healthcare facilities need a lot of solutions because it's a lot of problems. And after the pandemic, it really shined a light on how these long-term healthcare facilities aren't necessarily following the proper rules, aren't giving the staff the necessary training that they need, and also using kind of shell companies to profit off of individuals who are in these long-term healthcare facilities. So I'm just going to go do a high-level review of what's in the packet, and then or in our report, and then I'm going to open it up to all committee members to also add on to anything that I potentially missed. So the committee really focused over the last several months on a lot of things. We had several experts come in that does work in the healthcare field. We've had different departments from the city of St. Louis that can have input from the building division, the health department, that could kind of help this committee come up with our findings and to eventually draft this final report. Out of the report, like I say, we really focus on 3 top things, but that didn't stop us from expanding on our recommendations. So what you'll find in the report is a depth overview of 3 things that we really looked at: change in ownership, changes in residency population, and changes in staff practices. So for the changes in ownership, One thing that I learned also being on this committee from all the experts who've been doing all this great work is how a lot of these ownerships and individuals own these long-term healthcare is kind of hide behind for-profit and non-for-profit entities. So the Biden administration recently noted that private equity investment in nursing homes ballooned from $5 billion in 2000 to more than $200 billion in 2008. Nearly 1 in every 5 Missouri nursing home has changed ownership in the last 6 years, and 6 of the 14 remaining nursing home facilities in the city of St. Louis has changed ownership in the last 5 years. One thing that really, as a, like I say, new member of the board, but really stuck out to me as somebody who is diving into this conversation of long-term healthcare was learning about the for-profit, which is property companies, and then operating companies. So many for-profits use property companies or operating companies, also known as ProCo or OpCo, model to extract wealth from nursing home facilities and transfer into related parties to maximize personal profit. They do this by several ways. They invest money from nursing homes, from that PropCo or OpCo, and investors by owning the facility, or they own related parties with the facility that does business with the nursing home, or they own the facility underlying real estate and collect inflated rents, such as practices often associated with real estate investment trusts have drawn increase from regulars, such putting facilities on the hooks from ever increasing rent and negatively impacting resident care. So this allows owners to suck the asset out of these nursing homes, and they kind of put it into the for-profit or non-for-profit company, which in the long run, it takes away a lot of resources. It takes away a lot of asset that could actually be going into the nursing home. And instead of it going into the nursing home, they invest them into kind of these different entities and properties that they have. The number of nursing home residents are diagnosed with, and the way that they do is they're diagnosed with something called SMI, has increased dramatically during the past 2 decades. Almost 40% of those in St. Louis City nursing homes have been diagnosed with some type of bipolar disorder or schizophrenia. And they use these diagnoses to really kind of add to their bottom line and number. The number of younger residents in nursing homes have increased steadily and significantly as well. Between 2000 and 2022, the average age of a city nursing home resident age fell from 78 to 69. During that same period, the percentage of residents under 65 increased 16% to 39%. In 2000, 64% of St. Louis nursing home residents were people of color, from 59% in 2000. And I would say what's really, as I've learned, unique about how these nursing homes are getting residents into these facilities, like I say, they're using people's mental illness to kind of bring them into the nursing home to add to their number. And what we found is a lot of people in these nursing homes that are being considered mentally ill are young people, as well as people who are unhoused. Investors and other for-profit nursing home owners, in an effort to keep their beds full, they seek even higher returns in moving young people, sometimes with mental health issue diagnosed, and who are homeless in beds formerly occupied by seniors and people. So the ones who probably really need the care, not saying that our unhoused and our mentally ill do not, but what we've seen is how a lot of these nursing home facilities are really capitalizing off of a younger population, as well as people who have been deemed mentally ill. Nursing homes are getting less safe as a result due to this. Between 2019 and 2021, 346,200 nursing home workers suffered non-fatal injuries and illness that resulted in time away from work. A lot of these individuals, due to having some type of mental illness, sometime may act out. And unfortunately, when we get to the staffing, a lot of our home care workers don't have the adequate training to be able to interact with some of these individuals that are in the nursing home. Instead of staff who had appropriate skills to de-escalate training and are required to physically restrain residents, putting themselves and residents in danger, de-escalation training also teaches staff to de-escalate potential violent situations, heading of disaster. And what we, I guess, also, like I say, seen and collected over these last few months of investigation, without that de-escalation training, what we learned is instead of staff being able to calm down the residents in the nursing home, sometimes they go to restraining them to the bed. A lot of our mentally ill individuals that are in these nursing homes are being over-drugged and over-medicated and putting them in an early state of being in these institutions when they necessarily do not have to be. A 2022 long-term community coalition report found that roughly 250,000 nursing home residents receive powerful drugs each week. Without evidence of any type of diagnosis, Missouri is unfortunately one of the worst offenders when it comes to misdiagnosing and over-medicating residents, potentially holding them against their own will. And the second portion that we really focus on outside of the nursing home and the different models they have was staffing. As we know, the pandemic has left a lot of different sectors, different jobs out with staff where a lot of people are now working virtually. Unfortunately, our home care providers do not have that ability to be able to work virtually, especially when they're taking care of our most vulnerable. The COVID-19 pandemic exposed the long-term buildings of staff crisis in nursing homes. According to the Bureau on Labor Statistics, since March of 2000, the nursing home industry has shed 35,000 jobs, or if you look at that as a percentage, that's roughly about 50% of less staff that is now working in our nursing homes. What's even more crazy, in St. Louis, our CNAs, which is certified nursing assistants, who work in these nursing homes actually earn an hourly wage less than fast food, retail, or warehouse workers. Not saying that those other jobs are not just as essential, but our nursing home healthcare workers take on a big burden where they're taking care of our most vulnerable, and they get paid less than most people in other industries. And when they get their CNA license, they're still not making an adequate pay. Support staff includes dietary, environmental services workers earning even lower hourly wage on average, and many starting at a minimum wage. These jobs, with them being such low pay, are becoming unattractive. They also don't come with affordable benefits, which makes it harder for nursing homes to be able to attract quality workers. You have to pay these people that provide the support a quality pay, as we know, so that we can have nursing home owners who will continue to actually recruit and retain workers. If they do not get paid a quality, livable wage, no matter what job, but especially in our home care facilities, it will not attract workers that actually need to take care of our most vulnerable. What's also interesting is we learned that the Federal Center of Medicaid and Medicare Services, which is called CMS, cited Missouri nursing homes with 15,000 different offenses over the last 3 years. Missouri ranks 7th highest among all states for these type of violations. More than 300 were serious violations. CMS fined Missouri nursing homes 1,748 times during the past 3 years, which ranks 5th highest in the nation. So Missouri tends to continue to not to do well in these circles. We continue to not adequately not just support our staff that work in these industries, but as well as not providing a quality care of life for the individuals in these facilities. We also learned out of a report that came out in 2022 that the number of staff hours of care per residents fall lower than many in the nation. Missouri ranks, like I say, at the very bottom with providing only 3.62 hours of time per resident per day when it comes to staff and residents in these facilities. Again, Missouri not being at the top of the list, but instead being at the bottom when it comes to hours provided to residents, as well as making sure that they're following the guidelines. Thankfully to the Biden administration, it has stepped up to head off the staffing crisis in nursing homes and improve resident care. On September 1st, 2023, CMS released a proposed staffing standard for nursing facilities that translated to expect nurses staffing of hours of about 3.9 hours per residence per day. But unfortunately and not shockingly, a lot of nursing homes in Missouri decided not to follow those expectations, which only continues to put our nursing home centers in a crisis, as well as our staff not being able to have the quality care for individuals that are in these nursing homes. So again, our task was to come up with policy recommendations to not just charge the Board of Aldermen to hopefully do something, understanding a lot of these fights and a lot of these recommendations that are needed. It's not much the city can do, but I know this new Board of Aldermen is going above and beyond, thinking outside the box. We even have a member who sits on the committee who works for Congresswoman Cori Bush to figure out what can the city, the state, and the federal level do to improve the quality of life of individuals in these nursing homes, but also to stop the bad actors from not providing the quality care for the individuals in these nursing homes. So I'm gonna go over a couple of the policy recommendations that this committee came up with, and then I'll open it up to other committee members to also expand on other things that are in the report. So I won't go over every recommendation, but I will highlight, I think, some key recommendations from the city, the state, and the federal level, which we could be doing to ultimately improve the quality of life in these facilities. One of the recommendations that we came up with for the city of St. Louis is for the St. Louis Board of Aldermen to pass a resolution supporting nursing home staffing standards and federal transparency policies proposed by the Biden administration and Federal Center of Medicaid and Medicare Services. Something the Board of Aldermen also can do is the St. Louis Board of Aldermen will submit a copy of this report to the Missouri Legislature, the Missouri Department of Health, Senior Services, and the Federal Center for Medicaid and Medicare Services. The board will also submit this report to the St. Louis County Council, Kansas City Council, and Jackson County Council for their considerations to also do their part in their own municipalities. The St. Louis Board of Aldermen should fund annual education sessions for people living in HUD or senior housing regarding long-term care, as well as home and community-based services to help them be more informed on these decisions. The St. Louis Board of Aldermen should empower and require the division, building, and inspectors to use right to entry. So what this will do will allow the building division to use their inspectors to go into some of these nursing home facilities to ensure that they're running in a good standard and way, and we don't have the same situation that we just had in the city of St. Louis where one of the nursing home facilities shut down. The right to entry access nursing facilities where there is reasonable cause to believe that they're existing in a structure or upon a premise a condition which makes the structure or premise unsafe, dangerous, or hazard, and report and observe suspected unsafe conditions to the Missouri Department of Health and Senior Services or the Federal Center of Medicaid and Medicare. There's several more recommendations from the city end, but in lieu of time and for my other committee members to speak, I just wanted to highlight those. Some recommendations from the state level that we came up with is, so recently, just this last session, Governor Parsons vetoed $2.2 million in funding to long-term care, I may say this wrong, ombudsman program, which was vetoed again in 2013. So we're asking him to restore that money so that that program can continue to run to make sure that we have, like I say, a better quality of life in these long-term healthcare facilities. We're also requesting the Missouri legislature should increase the Medicaid per diem rate to match the Medicare rate with a percentage allocated for direct care and workforce requirement retention. The Missouri legislature should fund the Show Me Homes program more robustly, which will encourage institutionalization and strengthen communities. The legislator goal should be to reduce and ultimately eliminate waiting lists for the important program. And then the last one for the federal recommendations that we came up with, hopefully, again, we have our friend who works for Congresswoman Cori Bush could hopefully take a few of these on and charge these on the federal level, is for the Federal Center for Medicare and Medicaid Services, CSM, should require nursing home enrollment in Medicare and Medicaid to disclose whether they are owned by private quality investors or real estate trusts. CMS should enforce the new staffing standards and provide additional funding to states to implement the new staffing standards for nursing home. And CSM should strengthen regulations to prevent owners of failing facilities from purchasing others. One thing that I think is also really important that's in the report is it's one thing to talk about what's going on in these facilities, but it's another thing to actually have lived experiences from workers that are actually working in these facilities. And one of the leaders that actually work in this facility submitted testimony, which we use in the report to be able to talk about some of the conditions that's going on. So it's a story from Gabby, who's a leader with the SEIU Local 1, who talked about some of her experience that she's been noticing as she's been working in one of these long-term healthcare facilities. She stated, I have seen a lot happen and change in my time working at a nursing home in St. Louis. Workers are doing everything we can to provide quality care for our residents, but the conditions and residents are changing, often putting us at risk. A few years ago, my nursing home was bought by an ownership group from New Jersey. Their actions have shown us time and time again that their bottom line is more important than the residents or staff providing the care. In the summer of 2023, we went from 4 days without then the residents or staff providing care. In the summer of in summer 2023, we went 4 days without functioning air conditioning while temperatures outside scored above 100 degrees. It was only when the state stepped in that the board new air conditionings were installed. For months when I walked into work, one of the first things I did was I put my coat in the trash bag because the bed and the curtains was filled with bed bugs. Residents was being bitten and nursing home management wouldn't do anything about it. I didn't want to bring bed bugs back home to my family, so each day I put my coat in a bag and changed my clothes before I leave. Our nursing homes itself is crumbling with leaks all over and sewage backing up into the sinks in residents' room. These sinks then drip and make it very dangerous for residents and staff to walk around. There is nothing dignified about the conditions I work in or that our residents live in. Then I'll jump to the last sentence. Nursing home workers are doing everything we can to provide quality of life to our residents. We take on the jobs that aren't ours. We risk our health and safety. Workers need consistent training to better understand and care for the new type of residents that we're seeing in our nursing homes. Between the ownership, between the lack of staffing, one thing that this committee have seen or been able to come up with is we need help in our long-term healthcare facilities. We need owners to actually take on the ability to take care of the residents, but at the same time, we need to be able to pay our staff that are in these facilities a quality wage so that they could be able to take care of the most vulnerable that are in these facilities. Now I will open it up for any additional comments, because I didn't cover everything in the report, but additional comments from other committee members that will be highlighting other aspects that are in the report.
So thank you so much for your leadership.
And Laura, you can have the floor.
Thank you. Thank you so much for your leadership, and former Chair Ingracia, for your leadership of this committee. This would not have happened without you. The two of you are really our comrades in this campaign to make nursing homes better. Everybody on this committee is just very committed to this, and I'm hopeful that we can make a difference. Unfortunately, since we wrote this report, the Northview disaster happened. 184 workers lost their jobs overnight. More than 170 residents were suddenly switched to a new place. If you looked at the trends in this report, you could see it coming. This report seems almost clairvoyant when you think about what ended up happening right before Christmas this year with Northview, the largest nursing home in the St. Louis area, suddenly, abruptly closing. National news story, and we have to prevent another disaster like Northview Village. This can't happen again in St. Louis or anywhere throughout our state. So we've got to look at these trends. The fact that more owners are for-profit, more residents are younger, and that we also have more residents with severe mental illness diagnosis, the SMI that Alderman Aldridge mentioned earlier. We also have to look at the staffing shortages. In the state of Missouri, 6,000 workers are needed to work in nursing homes. We have a severe staffing shortage, so we need to take a look at the pipeline. So this report really points to the way to a couple of things that are needed, which include really substantial funding from the state of Missouri. There is money in the state of Missouri's budget. It's very important to fund the ombudsman program here in St. Louis. If Voice had been funded at the $2.2 million level that Governor Parson just line item vetoed last May, maybe we could have prevented the disaster of Northview Village. But nevertheless, it's just absolutely essential that they are funded this year at that level. It's also essential that we really start to take a look at what would make a big difference in terms of inspections. The problems that Gabby outlined in her story at Hillside are problems that are in many of our nursing homes. So it's really important to make sure that those state inspections are being done in a timely manner. So we're recommending that Governor Parson also, we, SEIU, is recommending that they really make a significant investment in the surveyor inspection process for nursing homes. Northview and many other nursing home facilities in our state, 1/5 of the nursing homes haven't been inspected in the last 2 years with a thorough, really deep inspection. It's completely unsatisfactory and needs to be changed. SEIU Healthcare is really proud to be part of this process. I don't think there's another municipality that has actually done this kind of in-depth work. And it's because of the people in this room and the people in this committee that this actually happened. Hopefully, we can take some of these results, pass some of the policy recommendations on the city level and on the state level, and then work with Representative Bush to pass them on the federal level as well. There's a lot of people with a lot of love in their hearts, a lot of commitment that they've already shown. We've just got to take it to the next level so that we can really prevent the kind of disasters that we've seen in the last year.
Thank you, thank you. Is there any other member on the committee that want to chime in? Make sure
I do.
We're going to start with you first, Ms. Jamie. Ms. Opsel.
Okay. Thank you. And I have to commend Laura and her team for everything that they've done for the workers. But I also need to commend my colleagues here, Annalisa Stover with the St. Louis Area Agency on Aging, Marjorie Moore with Voice, and Cassandra Kaufman and her team with the Mental Health Board. When that disaster happened on December 15th, we were so grateful to see the union there, as well as other dignitaries there supporting the needs of the workers. What we were looking for is leadership and being able to be the voice for older adults that were living there and people with severe mental illness. And it was very difficult to figure out who was going to take that lead because this has never happened before. We didn't know who should be speaking up on behalf of the residents. So we here in the city decided to take it upon ourselves and these organizations, Voice, the Mental Health Board, the St. Louis Area Agency on Aging, and the St. Louis Senior Fund came together to try to help find where these residents were relocated to and do wellness checks. Many of them were moved out of the Northview nursing home with just the clothes on their backs. And so between the Mental Health Board and the Senior Fund, we hired case managers to do the wellness checks. Slay and Voice took the lead on training these volunteers and these case managers to do the wellness checks, and the mental health board and the senior fund funded to replace basic clothing items and personal care items so that people had a few things because many of these people lost everything. And so I applaud all of the great work that this committee has done. But now have lived through this horrible emergency and experience of what these people went through, I'm very concerned that this is going to happen again, as Laura had said. One addition that I would make to this recommendation, if it's not too late, is not only should the city support the financial transparency policy review, but that should be that should be happening at the state level. The Department of Licensure and Regulation should be looking at how these funds are being transferred away from the care of the residents to these other businesses. Right now, there's a grant that is open to 2 states to be able to help change policy in the state of Missouri. We were hoping that the state would take a lead in applying for that grant and the state ombudsman program, and they are not. And I applaud my colleague Marjorie Moore for taking the lead in applying for this grant because we need to make policy changes here in Missouri because this will happen again. So those are my comments.
Thank you, Ms. Opso. I'm going to go to Ms. Moore. You have the floor.
Again, thank you so much to everybody. We're all of us here at Voice are just really grateful to be a part of this and really grateful to be a part of a community that really cares. As Laura mentioned, we have not found any evidence of any other municipality or even county doing this kind of work on our local level. And while we found a lot of roadblocks in a lot of ways, the city can't step in, that the state needs to be there. I think we found a lot of ways to really start to make change through building code, through fire code, and finding ways that we can fix things. And I think when it comes down to it, it comes down to having the people in the room that really care. And I really want to thank Jamie, Annalisa, Cassandra for everything that they did with you. Believe it or not, we are lucky that happened in St. Louis, because very few other areas have those 3 people in those 3 organizations. We're lucky to have a senior levy board that could contribute funds, and a very, very active area agency on aging that stepped up and helped coordinate people. So we're really lucky. If this happens somewhere else in Missouri, we're going to be in deep trouble. So I think the more that we can do to make sure that owners are held accountable for how that money is spent is going to be the most important thing. The other thing that I wanted to touch on in the report, we talk about de-escalation training and how important it is, and how staff has to do physical restraints and chemical restraints. And that puts staff in a really, really terrible position and puts residents in an awful position. Restraints, both physical and chemical, are actually illegal. So, that shouldn't be a position that staff are put in to have to do, and shouldn't be something that residents. And when it comes down to it, this report and hopefully the work that comes out of it is going to do so much good for residents that live in nursing homes. And I have to emphasize once again that nursing homes are homes. They're homes first. And this is where people live and often go to live out the ends of their days. They can be there for maybe a couple months to a couple years. And so we need to make these communities good places for people to live and thrive, even if they're at the end of their lives. So thank you again to everybody who's been a part of this. Mrs. Ingracia and Alderman Aldridge, I just really appreciate being a part of this.
Any other comment from other members? All right. One thing that I wanted, go ahead, Miss Annalise.
Hi, my name is Annalisa Stover. I'm the director of the St. Louis Area Agency on Aging. And I just wanted to echo the comments of Jamie Opsel and Marjorie Moore in the sense of the importance of the COOP plan, the continuity of operations plan, and the importance in terms of when the state is monitoring and if there are local monitorings occurring, to ensure that there is a strong continuity of operations plan in place so that when and if an emergency occurs, there's a clear process. With Northview Village, one of the horrible things that occurred is that prior to the state being called in or notified that this was occurring, people were taking residents and shipping them to other nursing homes. So that resulted in us having to track down, find people, check in with them, like Jamie said, doing the wellness checks, seeing what personal care items, what, lotions, sweatpants, shoes could be provided to assist people. And that is not the process that should be followed. So I would just put in a comment about the continuity of operations plan. And the real emphasis being on the owners to take responsibility for those residents to make sure that they land safely and in close and appropriate nursing homes. Thank you so much again to the Senior Fund and to the Mental Health Board and to Voice for stepping up to the plate to provide assistance.
Thank you, Ms. Annalise. Any other comments from members of the committee? So I would say moving forward, even though we don't have it like in writing, from the comments from Miss Jamie and Miss Annalise, as I was just talking with Miss Laura over here, I don't know, and Christine, maybe you could help if we could do like a friendly amendment to add that transparency and that plan in the report on the state level. Where we could just be able to add that to be able to adopt the final report.
Since this isn't a traditional committee, like a standing committee of the Board of Aldermen, I think that if we adopt the report, we can adopt it with the amendments that we verbally talked about this afternoon.
Okay. Good to have the legendary Ingracia on here. She keeps us together. Okay, so we will be from your comments, Ms. Stovall and Ms. Opsel. We'll be putting that in the new report. So we will adopt the report today, but I will get with Ms. Laura and figure out when we can kind of send out an updated one with those two added from the state level. Before I make the motion to adopt the report, I want to say first, thank you to former Alderwoman Ingracia, Director of Operations now, to President Green, as well as former Alderwoman Lisa Middlebrook and Alderwoman Pam Boyd, and everyone on this committee that have been part of this process, everyone that has come to the committee to give information. As a new alderman, I picked up the torch that Ingracia passed off to me, and it's truly been an honor to learn about the crisis. I mean, that's what it is. It's truly a crisis that we have in our long-term healthcare facilities. And like Ms. Moore said, these are individuals that are in their last days or, have to be in these facilities because something, a tragedy happened to them. And the last thing that they should have to worry about is not having a quality facility over their head and quality workers. And it's not so much on the workers. I don't blame the workers. I blame the owners for not providing the necessary training and paying livable wages to the workers that are doing a tremendous job, especially post-pandemic. We could never imagine the pandemic happening, but for the workers that are working in these facilities that had to continue to work in these facilities to take care of people while keeping their health safe at the same time, and having ownerships who change properties and how they change ownership of models to kind of rig the system, is just to the workers, like, thank you. Thank you for the work that you do every single day. Thank you to this committee for leading the charge, for picking up this crisis that's happening, not just in St. Louis, not just in Missouri, but all across this country, and saying we're going to do something. These individuals that are up here have not been getting paid to do this. They've volunteered a lot of hours that are up here and also on the stream, a lot of hours, a lot of time, and a lot of knowledge to this report to make it a report that even though the Board of Aldermen, like Ms. Moore said, don't have maybe the power to do as much as the state, but that doesn't mean we can't that we have to sit on our hands, that we cannot pass resolutions. I know the President Green, that her office is very dedicated to this issue. And I know after the report is done, this isn't the end. I know there's some conversations about all of us coming together to do something that I won't say until it all happens, but continuing to make sure that the work of this report and the work that all the members put into this report just don't stop after this committee adopts a report. So again, thank you to everyone who's dedicated so much time to uplifting and shining a light on our long-term healthcare facility crisis, and hopefully give some hope to a lot of people in these facilities that things are going to get better through our federal level, through our state. And I can say definitely down at the Board of Aldermen, we're going to make it happen. We're going to do it. And we're going to do everything we can. If it's different city departments trying to task them to do better in these buildings, or the Board of Aldermen working on resolutions and trying to look at legislation that we can do from the local level to ensure that the residents in these facilities have a better quality of life than what they've been. With that, I would like to make a motion that we adopt the long-term healthcare crisis pathway to safety and dignity for all report that was presented in front of us today.
Point of order.
Oh, point of order.
Would you like to make a motion to adopt the report with the change discussed verbally?
Yes, thank you, Ingrassia. I would like to make, I guess I'll pull my motion back. I'd like to make a motion that we adopt the report with the 2 changes from Ms. Opsel and then Ms. Annalise that will be added into the report that was brought up today.
Second.
All in favor, aye?
Aye.
Should we do a roll call? Any opposed? Motion carries. So the report is adopted. Again, there will be that was the first point of order too of the time. I like it to be stay on my toes. Thank you so much, Director of Operations. So the report is adopted. Again, I will get with Laura to make sure that the 2 changes from Ms. Opsel and Ms. Annalise is added on the state level, and then we will send this out to the full committee. Once those changes are made in the report, we will make sure that this is up on the city website. We was going to have it up today, but we're going to hold off until we get those changes so that we have a full report with everything that is right and tight, so that people can be able to see exactly what is in the report. Next order of business is announcements. Anybody have any announcements? If no announcements, I would, again, first, before adjourning, because maybe the last time, again, my announcement is thank you to everybody on this committee. It's just been a true honor to work with you all and be able to come up with a report that I think is going to be a great blueprint to other municipalities also doing the same thing. So thank you for all your tireless time and hard work on the report. And with that, I'll take a motion to adjourn. Is there a second? All in favor, aye?
Aye.
Any opposed? No. Motion carries.
All right.